Hi, welcome to Brother Be Well. This is the BB Youth Chat Series, and I'm your host, Justin Martinez. Super important topic we are discussing today. We're going to show you how to pack your mental health emergency toolkit. Joining me during this discussion is Associate Marriage and Family Therapist Malik Sampson from HearYou.org. What's up, Malik? We have Brother Be Well clinical advisor and marriage and family therapist Christian Jacobs.
How's it going?
How are you? We have Brother Be Well clinical advisor Julio Cruz.
Hi, everyone.
Julio. We also have our youth guests in attendance: Diego Martinez, Richard Toledo, and Shamar Knox. How's it going, gentlemen? Welcome to the show. How's everyone doing?
Pretty good.
Doing well. It's a nice day today.
Yes, it is. Yes, it is. Glad to have you all in attendance. This is a very important discussion that we're gonna talk about today. How to pack your mental health emergency toolkit. You know, mental health emergencies are very complex, and we can't always see when someone is in a mental health crisis. So we're gonna start this discussion off. I'm gonna call on the Brother Be Well clinical advisors to help me understand what a mental health crisis is. What does a mental health crisis look like? I'll start with Christian. If you could help us out, what is a mental health crisis?
Sure. A mental health crisis is when someone is experiencing um, symptoms, chronic mental health symptoms that's not allowing them to function at their typical level. For example, if someone may be experiencing psychosis, the definition of psychosis is when someone may be having audible or visual hallucinations, so they're hearing things, they're seeing things. This is outside of a normal cultural belief. So this is not saying, I see God. This is something different, more I hear someone in my voice telling me to kill myself. That's an audio hallucination. A visual hallucination is when someone is seeing things that may not be there physically. So they may be seeing a person coming towards them to hurt them. Oh, someone's coming to me to hurt me. So that's just an example. Also, it could be a crisis situation where they're feeling hopeless, and this is done through just assessing further when they're feeling a high level of hopelessness, of sadness, when they're experiencing times when they're having struggles getting out of the bed, waking up in the morning, really conducting their normal day-to-day life events. Those are some of the examples of when someone's experiencing a crisis situation where intervention is needed. There's a few ways to really assess for that. First of all, as I was saying, an appropriate assessment will be normal for a clinician to work with them, but for an everyday person, you want to really approach them with your concerns and find a suitable place where they feel is comfortable. And then there's a way to go about step by step assessing them. And if we maybe talk about that later, or we can get into that later if you like to.
Yeah, definitely. I know there's different types of crisis. You talked about psychosis. I know there's depression and anxiety. Malik, what's your take on depression or anxiety, panic attack? What does that look like?
So crisis is like just like Christian was saying, it's an intense like difficulty, a time of distress, and within that distress, a lot of times it can stem from underlying issues, like he was saying about psychosis, or you might have these more intense type of mental health illnesses. But it might be situational, right? You might be in a situational crisis to where someone in your family just passed away, and you just lost your job, and right, and now you're having this mental health crisis because you're in a life crisis, and that's when you can have this anxiety and that depression due to these life stressors and these things that are distressing you and causing you to not function properly.
Hmm.
And that I think that that's where the depression kicks in, when these things are happening and you feel that hopelessness of not being able to do anything, and the anxieties around like the future and the potential of the potential of what things even getting better, and then you go into this crisis mode. And I've seen that with clients that are having a situational crisis that turns into a big mental health crisis.
I see. I see. Thank you so much for that, Malik. Julio, do you have anything to add to these mental health crises that we haven't covered yet?
I think for me, something that is very important is to remove the stigma out of it, right?
Mm.
Because as we're speaking about mental health crisis, we think that there is something wrong with us. But let's say that you eat something that is not healthy for you, your body's going to react, right? You're going to have a physical reaction to whatever is happening, and you go into a physical crisis. The same thing happens with our brain. When life throws something at us, or there's events that may be very hard for us to manage, we can go into a crisis, not to mention that our brain is part of our body. So we can be suffering also from chemical imbalances that are going to affect the way we feel and we perceive things. And the crisis can be not just harming ourselves, but also maybe thinking about harming other people. So it's very important that we remove that stigma of looking for help. That is like number one thing for me, that if I need to go to emergency doctor because I broke my hand, I wouldn't think about it twice. So if you are ever in a mental health crisis, like just know that it's part of your body, and crises are going to come and go in life. And it's a temporary situation that doesn't require a permanent solution.
Right. So asking for help is a sign of strength, is what I'm kind of hearing from you, Julio. And it's a huge, huge tool to have when you're dealing with a mental health crisis, or when you're watching someone or witnessing someone going through a crisis.